Today we talk about assisted hatching. What is it? Why do we do it? And when do we need to do it? I'm Dr. Mark Amols, and this is Taco About Fertility Tuesday. One of the scariest things that occurs when you're going through the IVF process is you're hearing other people's stories of them going through the IVF process. And you start hearing about things that may not be used in your cycle, and that can be worrisome. One of those things is assisted hatching. And you hear about this and you think, well, are they doing assisted hatching on me? And maybe you found they got pregnant when they did that, but didn't when they didn't. And so now you're wondering about it. Well, in today's episode, we're going to talk about what is assisted hatching, what's the science behind it, when is it recommended, and what are the benefits. So to understand assisted hatching, you have to understand the structure of the egg. The egg on the outer portion has a part called the zona pellucida. And this is kind of a harder shell, whereas the inside, there is what's called an oolemma. And in that then has the cytoplasm and the nucleus. And so this outer shell, the zona pellucida, can sometimes be hard. And the thought is that when the embryo needs to hatch, it expands, it gets smaller and expands again, and gets bigger and then smaller and then bigger, to eventually breaking out of that shell, that zona pellucida. And so the people who have problems with embryos getting out of the shell sometimes need to assist it in hatching to open that shell up. And that is what assisted hatching is. So essentially, because some embryos may have a harder time hatching naturally, especially in certain patient populations, assisted hatching is a laboratory technique where the outer shell, the zona pellucida, of the embryo is artificially thinned or punctured to help the embryo implant in the uterus, because now it can come out of its shell and be able to implant. So if the science behind this is that the healthy embryo is not able to get out of its own protective shell, the zona pellucida, then how do we help it get out? And there are essentially a few techniques. The three techniques that I'm going to discuss is 1, mechanical hatching, 2, chemical hatching, and 3, laser hatching. Mechanical hatching is exactly like it sounds like. Mechanically, we are creating a small hole in the zona pellucida. And usually this is done with a fine needle, and it's able to make a small puncture, so that way it helps the embryo be able to break out of the zona pellucida. When it comes to chemical hatching, they use an acidic solution that can be applied to the zona pellucida to weaken it, so the specific area can easily be broken so the embryo can get out of it. And the last technique, which is honestly one of the more common techniques now, is laser hatching. And that's where a precise laser is used to thin the zona pellucida at a specific point. And this method is commonly used due to its accuracy and the reduced risk of damaging the embryo, because you can have this very fine point where you can break a little hole in the zona pellucida without affecting the rest of the embryo. Whereas with mechanical, it can potentially go too far. With chemical, the chemical can go too far. And with lasers, it's even got to the point now where they become so automatic, you can even draw a little line exactly where you want to go through. And it will be able to do that, and the spread of the thermal heat won't be that far, so it'll protect the embryo. At our clinic, we only use laser hatching. Now, it's important to know, if your clinic doesn't do that, it doesn't make it bad. Anyone who is good at the techniques, whether it's chemical or mechanical, are going to be just as good. But laser does add the benefit of being a little bit more accurate and reduce risk of damage to the embryos. So this sounds amazing. I mean, shouldn't everyone do it? Well, the answer is no. Matter of fact, even the American Society of Reproductive Medicine has a stance on this and says that it should have selective use, and basically recognizes that it can be beneficial in certain patient populations, but mainly for people who have poor prognosis for implantation or situations where there's concern for a thickened zona pellucida. So those situations are going to be women who are a little bit more advanced age, typically over 37, patients with repeated IVF failures, or cases where the embryologist saw that the zona pellucida was thickened and there might be concern. Or the other common situation now, the embryos were frozen. When it comes to the first part about advanced maternal age, the concern is that the zona pellucida hardens with age, so it makes it more difficult for the embryo to hatch naturally. And so by opening up that zona pellucida, it allows the embryo to hatch easier. When it comes to repeat IVF failures, think of it like we're just trying something. So after 2 or more unsuccessful IVF attempts, assisted hatching usually will be used at that point. Again, the thought is that it might benefit because you're doing something that maybe that's the problem. There isn't a lot of strong evidence that it helps in that situation, but again, there is very little harm since the risk is very small. Now with a thickened zona pellucida, it's pretty obvious that if you see that, you can make this decision that maybe I should help assisted hatch that. And that's a clinical decision made by the embryologist. They're not measuring it. They just know what normal ones look like. And when they see it thickened, they realize they should probably hatch it. Now, what's common today is that a lot of embryos are frozen. Matter of fact, most clinics now are doing frozen transfers, and that's because of some benefits that occur with frozen transfers. And when you freeze the embryo, what we find is that the freezing and thawing process can sometimes harden the zona pellucida, making a natural hatching more difficult. So it's pretty customary now to use assisted hatching whenever embryos are frozen and then thawed. At our clinic, we do assisted hatching on all the embryos that are frozen and thawed. Now, another point where embryos may be hatched is if you're doing PGT. If you're doing PGT testing, you have to get into the zona pellucida to be able to get to the embryo to get cells out. So technically, anyone doing IVF with PGT or PGTM or PGTSR is going to have some type of assisted hatching at some point during that embryo's development. But if they're frozen, one option is at the time before transfer, you assist hatch the embryo, so that way it has better implantation potential. So the obvious benefits is that it can increase implantation rates. Some studies have shown that in women who are over 38, there can be as high as a 5 to 10% increase, sometimes even as high as 20%. And we know that when it comes to frozen embryos, there is an improve in likelihood of implantation with assisted hatching. But are there any risks with it? Well, there are. And we talked about that a little bit just before when we talked about the laser technique. Because it's more accurate, it has less risk. Anytime you are working with an embryo, there is always a risk. Even just manipulating the embryo between dishes puts the embryo at some risk. And so although there is a small risk that the embryo may be damaged during the hatching process, it could potentially affect the embryo, and for it to keep developing, it may affect it and harm the embryo. Another risk is cost. At our clinic, we don't charge for assisted hatching, but some clinics do, and it can add on another $1,000 onto your cycle. And so for some people, if the insurance doesn't cover it or they're paying cash, they have to pay that out of pocket. The last risk is identical twinning. Monozygotic twinning, which means twins that come from a single embryo that split, be slightly increased with assisted hatching. Some studies suggest a rate of about 2 to 4% compared to the natural monozygotic twinning rate of 0.4%. So one of the concerns with assisted hatching is you're going to increase twinning rate. And not just twins, but a specific type of twins, monozygotic twinning. And that comes with other risks that are higher than just twins that come from, let's say, 2 embryos, fraternal twins. There's a risk of what's called twin-twin transfusion syndrome. And so that baby has a higher risk and it's twin because of this sharing of the placenta. And so that is one other risk that comes from assisted hatching. Although some studies do show benefits of assisted hatching, there are also studies out there that show there is not benefits. Some meta-analyses out there have shown increase in clinical pregnancy rates, but no significant difference with live birth rates when assisted hatching was used across all patients. In the end, most people aren't afraid to use assisted hatching. And just like the American Society of Reproductive Medicine, I agree, it should be used selectively. Now, at our clinic, like I mentioned, we use all frozen embryos for transfers. So for us, we use assisted hatching across the board. However, if we were doing fresh transfers and not doing frozen transfers, I would not use assisted hatching all the time. I would then use the ASRM recommendations of using it for women over 37, patients with repeated IVF failure, and cases where there's a thickened zone of pellucida. What's amazing is that technology is always getting better. The lasers are getting better, they're getting more accurate, which reduces the risk of thinning the zona pellucida. There are now some AI companies that can even look at the embryos and even tell us which ones need assisted hatching, versus us just guessing or basing off of certain parameters. In the end, assisted hatching does have a place. The question is it right for you? And so again, if you are at a clinic and you're doing PGT, or they're doing frozen embryo transfers, the embryos are going to be assisted hatched. If you're not at a clinic doing those, then likely they're going to use the same technique that ASRM recommends, which is using it in certain conditions. But as I always mention, it's always important to talk to your doctor. Just because your clinic doesn't do it doesn't mean it's wrong. And it's always good to talk to them and ask them about these things in your situation, because your case may be different. Not everyone fits in the same exact case. I know a lot of people ask me about assisted hatching, and I thought that's why this episode would be good. It will let people understand what it is and understand why it was used or not used in their situation. You may have a friend going through IVF, and maybe they have a question about assisted hatching. Let them know about this podcast. It may help them through it. As always, I always appreciate everyone that listens to this podcast. If you like the podcast, tell your friends about us. Give us a 5-star review on your favorite medium. As always, keep coming back, and I look forward to talking to you again next week on Talk About Fertility Tuesday.